Welcome back to the morning show here on Arise News. Chadwick Boseman's death in August at the age of 43 following a 4-year battle with colon cancer stunned fans around the globe, many of whom were unaware that he filmed 2 Marvel movies while undergoing cancer treatment.
Though Boseman was fit and otherwise healthy, his untimely death shone a spotlight on 2 major health concerns on colorectal cancer's rising rates among adults and especially Black people, who are much more likely to develop and die from colon cancer. Well, joining us now to speak on preventative and treatment measures for colon cancer is physician and health expert, Dr. Nesochi Igbokwe. Good morning. Thank you for joining us on the morning show.
Good morning, ladies. Wonderful to be with you guys this morning.
Great. Well, let's start with Chadwick Boseman's death at 43, which came as a shock to the world. Not only was he young, but he played that superhero we all admired, but was suffering and undergoing treatment for colon cancer for 4 years. First, I would like for you to give us, our viewers, a proper perspective of what colon cancer is, as it appears to be, a silent killer.
Mm-hmm. So we need to understand just in general what cancers are. So cancer really occurs when you have healthy tissue or healthy cells that become damaged and then actually proliferate and kind of grow out of control. So when this occurs in certain body parts, then you do have a cancer in that part of the body. So for a colon cancer, you're having this abnormal proliferation of cell growth of these damaged cells, specifically in the colon tissue. And we have to kind of get a sense of what the colon is and why it's so important. The colon is the final portion of the large intestine, and the real function of it is that it helps to absorb not only salt, but water, so that you're able to pass hardened stool through the body and pass it through the rectum.
Thanks, Doctor. And like we said at the start of this conversation, people were absolutely stunned to see Chadwick Boseman die at the age of 43 from colon cancer. And what's quite scary is that looking at statistics of today, it shows that people now, or millennials now, are 2 times more as likely to develop colon cancer and 4 times more as likely to develop rectal cancer than people were in the 1950s. Why is colorectal cancer becoming so much more widespread and prevalent?
So the incidence is becoming more widespread in the younger population. No one really knows exactly why this has happened. However, what we do know is that there are certain risk factors that we all know about that can contribute to problems with developing colon cancer. We don't really know why a colon cancer is going to start in a certain individual versus another individual. However, there are risk factors that we can control, and there are risk factors that we cannot control. Okay, so for the risk factors that we are unable to control, family history. Now, that is a very important, significant contributing factor. If you are somebody who has a family history of colon cancer, especially in a first-degree relative, meaning that you have a parent or a sibling that was diagnosed and has colon cancer, it increases one's risk to develop a colon cancer as well throughout the course of their life. Now, that is something you cannot control, your family history. There are factors, though, that we can control that we found that these factors do contribute to colon cancers. Now, one of these factors include basically some of the lifestyle choices you make on a day-to-day basis. Diet, for one, is one of the modifiable factors that can contribute to problems with colon cancer. So if you are somebody that's eating a high-fat, low-fiber diet, also filled with a lot of processed foods, processed meats, red meats, studies have shown that this increases one's risk for the development of colon cancer through the course of one's life. Additionally, other factors that we do have control of, just in regards to exercising and physical activity, Studies have also found that those who are sedentary, meaning that you're not getting a lot of exercise, you're not moving around a lot, you are obese. This is also contributing to problems with developing colon cancer as well. Other lifestyle factors that cause problems. If you are somebody who is a smoker, if you are somebody that drinks a lot of alcohol, smoking and alcohol also contribute a lot to the development of colon cancer. So, with all that said, when there are these factors that we can kind of take control of in our day-to-day lives, these are things that we should actually work on to make sure that we are not increasing our risk as we all get older.
All right. Well, you're right with that obesity factor as well, which is what we all need to watch. Well, according to a report by the Nigerian Medical Journal, colorectal cancer was a rare disease in rural Africa. But in the last 30 years, there's been a tremendous increase in the incidence of colorectal cancer. Well, as a medical personnel, can you elaborate on the reason for the rising rates of colon cancer, especially in younger people? You know, Chadwick was only diagnosed at the age of 39. I mean, that's really young to be diagnosed for that type of disease. And also in the African region, what is the reason for this rise in rates?
So again, there's that issue with the environmental factor, but something else that we really need to hone in on is the fact that there is not this kind of a focus on preventive health, especially in Nigeria. In regards to colon cancer prevention, we don't really have these measures that are fortified in place for screening. Now, screening is something that is extremely important that not everybody actually gets done. When we're talking about screening for these colorectal cancers, the colon cancers, now a colonoscopy is something that is the gold standard, okay? This is just a procedure whereby a tube is placed into the rectum to see and visualize, there's a camera at the end of the tube to visualize aspects of the large intestine and determine if there are any irregularities that one really needs to be worried about. There's not this great focus on these preventive measures to screen and detect these cancers earlier on. Okay. Also, in regards to the screening, not only are the colonoscopies important, but also checking for stool in the blood. They're very simple stool-based tests that are screening metrics to help any physician or doctor know that there may be an issue with a patient potentially having a colon cancer.
Thanks, Doctor. So, sort of a double question here. Why is the Black race globally more vulnerable than when it comes to colon cancer? And at what age do you believe, as a doctor, people should start getting screened? Because I understand that the U.S. Preventative Task Force is now calling on hospitals to start screening at 45. Screening used to be at the age of 50. What's your recommendation here?
So definitely in the Black population, screening should start and be initiated earlier at the age of 45. It used to be at the age of 50 because most of the research showed that starting from the age of 50, that is when you started to see the rise in the incidence of colon cancers. But we're now seeing that this is occurring earlier and earlier in life, especially for those in the Black community. Now, an important thing to note is regarding just your family history. If you are somebody that does have a significant family history of colon cancer, then that age might be younger for you in order to actually get screened for a colon cancer. So I think what's key to realize is if you have a significant family history, do not ignore that. If you have a family member, your mom, your dad, siblings who have colon cancers, you really need to be aware of this to determine when you really need to get checked out and you need to be screened. So just in general, if you're somebody who has a family history, let's say you have a parent who was diagnosed with colon cancer at the age of 50, then the recommendation is that you should be screened and have that initial colonoscopy 10 years younger than the age that that first degree family member was diagnosed. So if you have a parent that was diagnosed at the age of 50, you should be getting screened at the age of 40. So it just really depends on family history and also your own personal history of polyps and other potential medical conditions that can put you at higher risk. But for a general average risk individual, that screening should occur at the age of 45.
All right. You know, research shows that almost 10% of people diagnosed with colorectal cancer die within 1 month of the diagnosis. Well, as well, at least 50% of patients who die within 1 month receive no active treatment. With this, how do you rate the level of awareness for colorectal cancer in Nigeria? And how can we raise more awareness for this disease?
So I think the level of awareness is somewhat low in Nigeria in regards to colon cancers and in regards to knowing the symptoms to look out for so that you can actually get screened and checked out sooner. A lot of the times, just in regards to what you were saying, the survival rate is very low in Nigeria because guess what? A lot of patients that are diagnosed, they are diagnosed later on in the later stages of the disease process when it is harder to treat. So I think a key thing at this point is educating oneself to realize what some of the symptoms are that one really needs to look out for. And I just want to go through some of those symptoms because I think that is really key to give you a sense of when you need to touch base with your doctor to let them know that some of these things are actually happening to you in the body. So you need to know when there's a change in your baseline in regards to some of your bowel habits. So if you're somebody who is having normal stools and then all of a sudden you are noticing there's this continuous change in your stool whereby you're always having diarrhea or you're always having constipation or you're always having very thin looking stool, then that is a cause for concern. If you are noticing that you have blood in the stool, a very black colored stool, that is a cause for concern. If you are suddenly always having consistent abdominal pain that was not there before, you also need to be checked out as well. Other things to look out for: extreme weakness, weight loss that you didn't intend to actually have. You weren't trying to lose weight, but all of a sudden you started to lose weight. Also, just a sense of not being able to really relieve your sense of defecation.
Do hold your thoughts for just a moment. Let's go on a very quick break and we'll be back with more. Welcome back. You're still watching The Morning Show here on Arise News, and we still have Dr. Nesochi Igbokwe with us talking about all things to do with colon cancer. Doctor, many thanks for staying with us while we went on a quick commercial break. Do continue with what you were saying, Doctor, before we went on a break. And to add to that as well, what is the long-term global outlook now for colon cancer in terms of trends that we can currently see and the way that things are going?
So the global outlook and the trends that we can see is that pretty much the age at which these colon cancers are occurring is at a younger and younger age in one's life. Therefore, that need for screening at the various stages of life are so key and so important. So what I was saying before the break are some of those red flag symptoms that everyone really should be aware of, because these are symptoms that should kind of, ring that bell to let you know, I need to go see somebody, I need to go get help. So we talked about blood in the stool. We talked about change in bowel habits. We also talked about, or what I was saying was, if you have the sensation of this urge to defecate, and after you have actually used the restroom to defecate, you still have that continuous urge and sensation that you haven't actually cleared the bowel. That's also another symptom to be aware of. I think the important thing is when you do identify some of these red flag symptoms, it's now what? What is the next step? Okay, so when we're talking about a country like Nigeria, whereby there's not really a very strong or fortified healthcare system, what is one really to do when you do have these red flag symptoms and you bring it to the attention of a doctor? If there's limited access to healthcare, that's another issue as well. So that's just something to put in consideration in regards to some of the problems that arise in Nigeria when there's not really this strong emphasis on preventive health.
Right. So you've touched on the symptoms, the causes, and the diagnosis of this disease. I'd love for you to elaborate on the treatment options that we have for colon cancer and survival rates.
Okay. So the treatment option is really going to be dependent upon the stage of the cancer. When we're talking about colon cancer and just stages, there are various factors that contribute to what kind of treatment modality is going to actually be used. Stages start from stage 0 to stage 4. Stage 0, pretty much you're just finding certain new changes in that organ system. And when you get to stage 4, this means that the cancer has widely metastasized and has gone and spread to various regions of the body. It may spread to the liver, it may spread to the kidney, it may spread to various organ systems. And then just in between, in stage 1, 2, and 3, those stages are basically based on the size of the tumor, if there's any involvement in lymph nodes. But the way to kind of think about it is, as you progress from stage 0 to stage 4, that reduces one's real chance for survival long term. So that's really key. But when we talk about treatment, depending on the stage that you're in, treatment could encompass various things, including surgery, including chemotherapy, and including radiation. But the treatment that one would get really depends on what stage that this tumor actually is in.
Thanks, Doctor. And as we know, millions of new cases of colorectal cancer are diagnosed every year. There are so many people right now living with colorectal cancer. How can people who have loved ones, family that have been diagnosed with colorectal cancer, how best can they show their support during such hard times?
So one thing you can do is obviously be a support system and be somebody that can actually listen to some of the concerns and some of the maybe the pain symptoms that a friend or a loved one is going through. But another thing you can really do is spread the word in regards to awareness. Spread the word on some of the symptoms that one needs to look out for. Make sure that prevention is a priority, not only in your life, but in the life of others, so that they may not have to deal with some of the hardships that go along with a colorectal or a colon cancer. I think the key is we all educate each other, we continue to raise awareness so that if someone else goes through it, maybe perhaps they will be able to detect their cancer sooner than another individual. But really, just being there for one another is key.
Well, you've touched on the risk factors for colon cancer. I'd like for you to share with us, some lifestyle changes that, we can adopt in our system once we've been diagnosed with colon cancer, or just in general.
So just in general, the lifestyle changes that you need to integrate into your life. When we're talking about diet and exercise, those are the two key things that you'll always hear any doctor talk to you about in regards to any disease process. But when we're talking specifically about colon cancer, we know that if you have a high fat diet filled with processed foods, processed meat, red meat, that increases your risk. With that knowledge at hand, what can you do to actually change your diet on a day-to-day basis? It's now time. If you are somebody that's eating a lot of red meat, a lot of processed foods, a lot of junk foods, today is the day to kind of start to change some of those unhealthy habits. You want to integrate certain things that promote a reduction in your risk of colon cancer. So what you can do dietary-wise would be to integrate things like fruits, vegetables, and other foods that are high in fiber. Just doing that can lower the risk of development over time. If you are somebody that's sedentary, we know a sedentary lifestyle can lead to obesity. We know that sedentary lifestyle, being obese, can also increase one's risk for colon cancer. So an important thing to do, you need to make exercise and physical activity an important component of your day-to-day life. If you are someone that's not used to working out or exercising, just start with just basic walking. This is what I tell a lot of my patients that I see on a day-to-day basis in regards to physical activity. Just something as simple as 30 minutes of a brisk walk 5 times a week can really be helpful in optimizing your health and also lowering and reducing your risk of certain diseases, including colon cancer. Also, other things to keep in mind in regards to some of the day-to-day things that you can actually integrate into your life. If you are somebody that smokes cigarettes, now is the time to really stop. Now is the time to try and quit, because we know that doing that increases your risk. If you drink a lot of alcohol, it's time to cut back. Moderation is key. If you continue on that path, we know that this is something that's going to harm the body and increase your risk moving forward. So when we talk about lifestyle changes and lifestyle modifications, that is something to actually take quite seriously. And there are just various day-to-day things you can always do to ensure that you're on the right track and on the right path.
Absolutely, Doctor. It's so important. Unfortunately, we've run out of time. Many thanks to you for such an important conversation this morning on colon cancer, preventative measures, and the lot. It's time now for a short break on the morning show. When we're back, we're going to have a conversation with fitness and mental health coach Maje Aida. He's going to be here speaking on the topic, or rather the psychology and effects of the EndSARS protest on victims and Nigerian youth. Do stay with us.